Well, I saw an incredible article that dove into the space where my questioning was, which is a lot of how this show is put together. Just what am I thinking about? I'm imagining you're asking the same questions. This was in the Journal of American Physicians and Surgeons. The treatment of viral diseases. Has the truth been suppressed for decades? Lee D. Merritt. This is just one excerpt. As the pandemic broke out, I constantly watched and read online publications. After reading about the Chinese, Indian, Korean use of hydroxychloroquine, an anti-malarial agent against coronavirus, within an hour, I found more than 20 scientific papers written in the last 40 years on the use of lysosomotropic agents, specifically chloroquine, to treat viruses. Like Rip Van Winkle, I suddenly awoke after decades to a completely new medical reality, a new medical reality. It may be difficult for non-physicians to appreciate the magnitude of this world-shaking scientific omission and probable cover-up. It is the pharmaceutical equivalent of being told for 40 years the world is flat, only to have it conclusively exposed overnight to be round. It is my honor and pleasure to bring in Dr. Merritt, who I have wanted to speak to for a very long time on my show. We've been in a couple of discussions in Zoom calls with other doctors, and of course, she works very closely with the frontline doctors that have been putting it all on the line to bring the truth to us across America. Lee, this is an incredible article and an incredible paper you're writing about. But when we hear that there's no evidence that hydroxychloroquine works or that antimicrobials work, what do you say to that now? Why did you write this paper?
Well, what you read is exactly right. I always tell people, trust the doctor that has your disease. They know everything about it. So what happened was, and this wasn't just me, I mean, this is how this whole thing came to be. There were people like Didier Raoul and that had, expertise in this area. But most of us, like I'm an orthopedic spine surgeon, what do I know about viruses? But we're all sitting home, we're in lockdown, or even before we got to lockdown, we're all watching this come across China. And then we're watching it go into Lombardy in Italy. And that's when I started worrying about this and saying, wait a minute, what's happening? Because when doctors and nurses start dying, there's a problem. Again, right. When we can't treat ourselves, there might be a time to go to the basement. Well, but then I started looking, so what do? Well, our response, most doctors, our response is to study this. What can we do? What do we know about this? What are the alternatives? So we started doing this, and I wasn't alone. I have a very good friend from the frontline doctors who's in El Centro, California. And he did the same thing, and he figured out a protocol. While people were dying in New York, he figured out a protocol using the Zelenko thing, and Zelenko figured it out independently. It's by reading the literature. And what's shocking to me, I came across this old medical literature talking about chloroquine. And it talked about, it went back to 74. And by the way, I just found ivermectin literature back to 1970. So really? This isn't new. There have been people that have found this stuff, and they showed the mechanism of how it stopped viral replication. Well, if it stops viral replication, why did nobody take it forward? Yes, okay, in 1974 it was in a Petri dish, but they could have taken it forward. They could have studied this. Think about all the people that have died of viral diseases, not just COVID. This isn't just about COVID. It's about the flu or flu-like illness. Every year they tell us, oh, take your flu shot because 60 million or 60,000 people last year died of flu. Well, that's actually, they died of influenza-like illness. The CDC doesn't even really count flu. But they died presumably of a viral-induced problem. And how many of those could we have saved had they actually pursued the research on this? So you have to say, and the other thing I'll tell you, so yeah, I'm an old fart, and I graduated medical school in New York in 1980. But my son graduated in 2011. He's a general surgeon now. My good friend is a 40-year professor of medicine, just retired from a major university. And I asked both of them, okay, had you ever heard, not just that we could use it, but there was ever inkling that we could treat viruses? We were always told, no, you can't treat viruses, that we don't have antimicrobial agents for them. And that's not been true, and they've never been told that. It's an unbelievable story.
So across the generations, science and medicine is still saying you cannot treat a virus. The only way forward is a vaccine, which is what we've all been waiting for. And we've had this crazy situation where when doctors have done their research like you and used ivermectin, or especially used hydroxychloroquine, and perhaps maybe that would have gone on to be much more successful had the President of the United States never mentioned it, because then it became a political football and nobody could go near it because we couldn't have Donald Trump be right about something, I think is what it seemed to be. But, you know, I had a moment. You talked about Vladimir Zelenko. I ran into him when I was in D.C. speaking at an event recently. And this is what he said to me at that event very quickly, briefly. I brought a cameraman over talking about, he had just published now, he says over 1,000 patients, I think, that he treated with hydroxychloroquine, azithromycin, and zinc. It's called the Zelenko Protocol. It's being tested and studied all over the world. He's had amazing success, yet there are still states that don't allow it at all. This is what he had to say about that.
There are two risk factors why people die from COVID. It's the state that you live in and the doctor you choose. And the reason why I say that is that certain parts of this country are obstructing the flow of life-saving information and life-saving medication. The data shows that if you treat high-risk patients within the first 5 days of onset of symptoms, the majority of them, more than 84% that would have ended up in the hospital, don't. So let me just give you what that actually means. That out of the 300,000 dead Americans, let's say, we could have prevented 250,000 people from dying. 250,000 people.
Yeah.
And we could have prevented the shutdown. We could have even prevented the psychological trauma that everyone's living through.
Right. 250,000 people could be saved is what he believes based on the data. I think Didier Raoult would guesstimate somewhere. In fact, most of the people that use this product believe that they were having in that vicinity, right, of the high-risk patients, about an 84% success rate, keeping them out of hospitals. Of course, some of the studies that they pointed to say it didn't work waited until people were already on ventilators before they delivered the product, when we know in medicine, and I worked at the Doctor's Television show, that the earlier you treat somebody, the better. But what is your thought? I mean, do you see it the same way? Did somebody actually decide to murder, in my mind, innocent people? He went on to say in that video, it's a crime against humanity. What is your perspective?
I absolutely think that's true. I think what he said was exactly right. And actually, there was an online study that looked at all these countries that were they separated them into two groups of countries. They uploaded data open source. Nobody could argue about how it was done. It was open, transparent. And what they did was they looked at the countries that used hydroxychloroquine early and frequently versus the countries that did not. And it was a 78% decrease in mortality if you were in one of those countries that routinely used hydroxychloroquine. I looked at the numbers in New York State. In the COVID season, this was in the natural viral season. So I gave a talk in middle August about this, and that was about when I looked at these numbers. And the percent per capita death from COVID in New York State was 0.17%. So it's still, you had a 99.83 chance of survival in New York State, but a 0.17%. Contrast that with Nigeria. Nigeria, a third world sub-Saharan African country, and the death rate was 0.00004%, 10,000 times less. Wow. What's the difference? Well, I had a patient of mine from there, and a patient from Senegal, same story. And they told me that they have hydroxychloroquine over the counter. When they get a fever, they're so used to malaria there, they get a fever, they just go down to the corner drugstore and they pick up some hydroxychloroquine and they take it for a few days or however, and it's gone. And that
so
is
that
a sad
fever,
commentary.
the deadly COVID-19 just disappeared.
Right. It's a deadly commentary on all this. And, and I had, exactly the same thought you did, Del, about it's just Orange Man bad. That's why they were against this. But I got to tell you, I don't think that's why I wrote that paper. I think there's much more to it than that. Okay. Because we knew by the way, doctors knew about this before Trump even mentioned it. Because like I say, we've been on our computers reading. That's what we do for a living. We study. So we knew about that. So it wasn't just that. I think the other, because it was so much bigger than that. The second thought I had was, well, if you have a treatment for something, then clearly you don't need a vaccine program. And if this treats other viruses, for example, I found a 2004, I believe, article from Chinese researchers saying chloroquine inhibits influenza A in vitro, meaning the flu virus could be stopped by this. That's when my head exploded. And I said, oh, that's what this is all about. They don't want their $69 billion a year vaccine industry to go to zero, because you won't have to, if this actually treats all sorts of viruses, you won't have to be taking vaccines. Well, I think that's part of it. But even more than that, I think there's another point here, and it's the one we're facing right now as we watch this. I'm a former military surgeon, and I have to say, I think there's a lot of psyop. We're probably at war here. There's a lot of things going on, and they don't really want us to know about treatment, because if you have treatment, then you cannot be terrorized by by lab-produced viruses, and that's a big one. That is really a big one. Look at what's happened to our nation. Our nation wasn't taken down by a virus. It was taken down by fear. If you have treatment, the fear goes away.
Right.
And I think in favor of that argument is, did you see the hydroxychloroquine plant in Taiwan that just burned down? And they said it was all chemical by accident. Right. But we've had two other plants last May that also down that also produced precursors for hydroxychloroquine.
Wow.
So there's more to it than just they don't just orange man bad. I don't think that explains it.
So, we have had a lot of conversations about that. Of course, we've been reporting on hydroxychloroquine from the beginning. And what I found really interesting about your article was what I was asking was, this doesn't make sense. Like, there's, as reported, there's certain things that send off red flags, right? You have a crisis. You have a deadly pandemic supposedly sweeping the nation. You have the PrEP Act, which protects doctors and nurses and hospitals and drugstores. I would joke when you read the PrEP Act that a doctor could shoot you in the head, and as long as they say that just seemed like the best treatment at the time, the PrEP Act will protect you and say, we agreed, you did the best thing necessary. Nobody has any risk because and it's a great idea. I'm not against it. The PrEP Act is basically saying, in an emergency, we need doctors to, jump outside the box and try anything that they can imagine. And so, ironically, around the world, many scientists found the same thing that you did, hydroxychloroquine. And, Zelenko called Ryut and said, you can even use a lower dose if you add zinc. And so you all started sharing this information, and it was working really well. But I thought, why was there a sudden attack? I mean, not only did you have sort of this flippant Fauci saying, well, I'm not sure that I really think that has any promise, even though we ended up reporting on a study in 2005 that the NIH did showing that it was very successful against SARS. Right there, chloroquine is a potent inhibitor of SARS coronavirus all the way back in 2005. And, that's right inside the NIH and Fauci knows it. So my question was, there's got to be something they're not telling us. Is it possible? My theory was that this idea of a product that can open a cell so that you can have the component that can kill the virus that's entered it, whether it's zinc in this situation or maybe it's selenium for something else. But is it this process that they don't want the world to know? Are we looking at perhaps a miracle cure for Ebola, for flu, for these things that vaccines have never achieved? When you look at this, are we really, it's one thing to have a treatment. Is it possible we're shutting down one of the great cures and discoveries of the future?
Yeah, it's not just possible. I think it's probable. And, ivermectin is another drug that got the Nobel Prize because it's such a wonderful drug. And these other, they're also relatively inexpensive, or they used to be. They were cheap drugs that had been around for 70 years. They're not ivermectin, but hydroxychloroquine. They've done everything they could to discourage you from using it. We never heard of people were on Plaquenil for their rheumatoid arthritis for decades at bigger doses, longer periods of time. We never heard about cardiac concerns, really. Right. I went back and looked at the old package insert. It never said anything about it except that it's a theory. It's a theory, it's theirs. It was a very small, they couldn't even come up with numbers because the risk was so low. Nobody was talking about it until now. And now you have pharmacists. I know a pharmacist. I can't go to that pharmacy for my patients because she just won't prescribe it because, are you aware of all the risks? And I'm just not morally going to do it. And it's like, if this had been any other drug that came out with this surprisingly good result, it would have been shouted from the highest yardarm. If this had been a big expensive drug by big pharma, but it's a cheap drug. It's well tolerated. but it obviates a more expensive thing. And I have to say, the other motivating factor here, which I don't know that I had in my paper, but seems to be the case now, is this vaccine. For some reason, they really, really, really want you to have the vaccine. And you're more expert in vaccines than I am. But you know, have you ever? I mean, I've been in medicine for 40 years. I have never seen a vaccine rollout that preceded FDA approval.
Yeah.
That's exactly what happened here. They put, I don't know how many doses, but doses all over the country into chilled warehouses where they had to keep it at 80 below zero for this Pfizer vaccine before the FDA even adjudicated the scientific paper and the research to say that they agreed with it. Okay, I'm not a big fan of the FDA, but at least they used to make a show of caring. Yeah. Okay, they didn't care about this one. And we've never, keep in mind with this vaccine, we've never passed animal testing. It's made it three animal tests on mRNA vaccines, and all the animals died. It wasn't a subtle endpoint. And yet we don't have any long-term testing, and it's only 2 months in humans, and it's already rolled out, and it's becoming mandatory. And thank you for standing up for that. But again, it seems like they really, really, really want to press us to have this vaccine for reasons that we can discuss. But I think that's one of the reasons they really, really, really don't want us to have hydroxychloroquine, because it obviates the need for that. You don't need, and that's true of anything, you don't need a vaccine if you have a treatment in your pocket.
And a treatment is a far better way to go, right? Because as I pointed out today, we now know that 99.6% of the population of the world, even better in the United States of America, 99.6% of us are going to have a mild symptom if we even happen to catch it. Here's the numbers in the world. 25,864,275 are having a mild condition, while only 110,000 are in that serious or critical range. It's obviously gotten better. I don't know if the treatment's gotten better with that, or maybe the virus is weakening, which viruses do based on evolution, and making it even more risky to take a vaccine that's never been tested versus sort of standing your ground. And if we had a treatment, that 0.4%, you know, what Didier Raoult is talking about and what Vladimir Zelenko, what you're talking about, we would be reducing it down to probably 1% or nothing at all. This could have been a nothing burger, but instead there were interests involved. You know, I got attacked. I talked about it. This reporter was really drilling me about hydroxychloroquine and these issues. And he said, more science has shown that hydroxychloroquine doesn't work. I said, that is just categorically not true. Let's bring up the stats just so people can look at it. Here's the fact of where we're at right now when it comes to hydroxychloroquine studies. There's been 195 trials around the world. 3,074 scientists have been involved in them, and 166,999 patients. You can see the results there, all of them positive for the use of hydroxychloroquine. On the other hand, you have a handful of studies, most of them terrible, given after the people were already on ventilators, as I talked about, or in a high-risk group. And then you had the two worst studies. Many of them, actually several were pulled. One of the big ones was pulled from The Lancet. The Lancet has made one of the biggest retractions in modern history. How could this happen? The now retracted paper on hydroxychloroquine, that was the one that Fauci was pointing to, saying, see, it's dangerous. They had to retract it because the thing was a total fraud. And then you have two studies that are being promoted by the WHO, both of which gave lethal doses of hydroxychloroquine, didn't include azithromycin and zinc. When you look at Vladimir Zelenko using 400 milligrams of hydroxychloroquine, Didier Raoult using 600 milligrams, but in these two studies, they decided, hey, as the CDC and the FDA and the World Health Organization, let's look into this thing that these doctors are saying is saving people. They're using 400 milligrams. This guy's using 600 milligrams. Why don't we try, just throw that out. Let's go with 2,400 milligrams per day is what they ended up using in the Solidarity trial, and I forget the name of the other one, something similar to that, where there it is, each trial gave patients a cumulative dose during the first 24 hours that, when given as a single dose, has been documented to be lethal. When you look at that, as a doctor, as a scientist, as someone that cares, and I believe, I don't know how to explain this. My own father keeps saying, doctors love people, right? They get into that profession to protect people. How do you explain doctors stepping away from a treatment? There's a friend of mine that's a doctor that has been delivering hydroxychloroquine. The head of the hospital says, you do that one more time, I am going to fire you. And she said, but it works. All of my patients are doing better than all of my coworkers. Why would you? He said, it doesn't work. Stop it. What leads a doctor to act like that?
Well, there's a real problem with groupthink. That's one of the problems, and we've always had that. There's much more to it than that. But here's the thing: there's really kind of three groups of doctors here, and I say this because I still, like I say, my son's a physician in training. There's the group on the top, and the group on the top of many hospitals and the orthodoxy in medicine, the big medical societies and things, they are being funded by big pharma and these organizations, these Rockefeller Foundation, whatever, for doing certain things. And if they don't do those things, when government wasn't involved in funding, if you found something that took you in a different direction, you could turn on a dime. But when you have government funded research, or when you have these foundations, if you go against what you're out to prove, then you lose everything. And it turns out, we just heard in the news that Dr. Fauci is the biggest paid federal employee we have in the nation. Who knew that? But beyond that, here's another thing I discovered. If you really look at him, who has the ability to give billions of dollars, who personally allocates, without congressional oversight or any kind of oversight, billions of dollars in funding to people? Anthony Fauci, through the NDAID and NIH. So he's been able to set himself up as this, the kind of the spider in the web of all these different organizations. And I'm sure if he tells them you have to use remdesivir and you can't talk about hydroxychloroquine, the guy that's getting 88% of his hospital funding from him says, okay, yes, sir. I have a feeling that's what's going on, because there's a funding problem here. Remdesivir is a very expensive drug that they're trying to push on people. And I can tell you that people that refuse the remdesivir because they want to go in the hospital and get hydroxychloroquine or ivermectin, they can be, I've had 3 patients that had this happen to. They were kicked to the curb without basic medical care for low PO2. In other words, they were short of breath, coughing, they didn't have enough oxygen, and they were discharged or threatened to be discharged. I talked to one patient, I said, try and keep them overnight so we can help you the next day. They're just kicked to the curb. This is immoral medicine. So the people involved in that are taking this money, they've been bought. And there's that group. And
but what about the person that pushes him out the door in the wheelchair? What about the person that says, I'm sorry, my boss is making you shove you out the door so that you can go die at home? I don't understand that, Dr. Lee. How are they doing that? How is it? How do they go to sleep at night?
Well, and then keep in mind that then that's the next set of doctors. Then there are these doctors and the nursing staff. They don't have the time, energy, and probably medical expertise to research this independently. So they're doing what they're told. They're being told this is a difficult patient who refuses the standard of care. Okay, and we've gotten ourselves in this by demanding these standards of care. If you don't do what we say, then you're wrong. This is a bad situation. The definition of standard of care is if I don't do what 90% of doctors in my area do, I'm considered wrong. It used to be the 10% were the people that innovated and made medicine better, but now we're considered wrong. Okay, that's the government definition for the medical boards. So there's a group of doctors in the hospital that are stuck, and they're the young doctors in training. And I'm going to give them a pass in this because if they speak out against the orthodoxy, they'll lose their residencies. Okay, I get that. But there's a huge group of doctors in the middle. And these are people, I'm independent. I'm in my little practice, and it has nothing to do with this, so I could speak out. But I'm going to tell you, there's a bunch of doctors in the middle who are working in hospitals or in organizations like Simone Gold was in I think Kaiser when she was fired for telling people exactly what you said. Wait a minute, hydroxychloroquine is saving these patients in the emergency room. There are people in the middle there. And they're the ones that I think need to get a moral backbone here, because this is what we've seen elsewhere. Most of the people in the death that took care of people in the death camps, they weren't executioners. They were little people that made the baked goods, that, moved people in trucks, that just cleaned the floors. It's everyday people thinking, I'm just going to do my everyday job and I'm not going to be morally culpable. But unfortunately, as we know from when we tried the Nazi doctors and hung some people, we hung them. What did we hang them for? Because not necessarily because they killed people themselves, but because they went along with a system that was killing people. And look no further in this than our elderly. We are we are basically killing our elderly by omission and by commission. We've put them in solitary confinement. You know, you got to. I have to laugh a little. The sarcasm of the day by Governor Cuomo, who said, "Incompetent government kills people." How can he be so clueless as to realize that's him? You know, he said
Right.
that literally. So we put them in nursing homes. We feed them a terrible diet. We don't give them the supplements that we know works, like vitamin D. Big deal about vitamin D in this virus. Zinc. We've learned a lot of things from this outbreak. Vitamin D, zinc, C, selenium, quercetin. These things work. Yeah. And then we could prophylax them with 2 pills of hydroxychloroquine a week. This total protocol would cost maybe $5 to $6 a week per patient in the nursing homes. But what's happening? 40% of those 300-some thousand deaths in America are nursing home patients.
Amazing.
We're letting them die. And so the doctors that are not in training, you need to wake up, because you're doing this. You have the opportunity to save people, and you're not looking at the literature. And you know, the information's out there. It's not that there are no studies. That's number one. There are lots of studies. Number two, science is not a vote. It's not about how many studies say one thing and the other thing. It's about the truth and what works. And the people that are not working for government shows it works. So I think we have a moral problem right now in medicine.
We absolutely do. And Lee, it's only going to change if more and more people like you step up. I want to thank you for being a hero today, for being courageous, for standing and speaking for those doctors that are still afraid. To you doctors out there, of course, you can always write into our show if you have a story, if you want to share the information, you want to do that anonymously. You can certainly write into our show. Kat, where do they go? Whistleblower at ICANDecide.org. This is where a lot of our information is coming from. This is why we do keep winning lawsuits. We have information coming from sources that are right inside of the places we may even be suing. Whistleblower at ICANDecide.org. All of that will be confidential. It's all totally encrypted when you work with us. So Lee, thank you for not being a silent and anonymous whistleblower, but stepping up, doing this research, and bringing the truth to the world. Hopefully we'll reach enough minds and a clearer and better thinking time, not driven by agenda and funding, but an actual concern for humanity, in which we will allow doctors to do their job, to allow products that have a 70-year safety record be used, especially amongst doctors that believe in it. I don't even care if it's the placebo effect. If the doctors believe in it and the patients are believing in it, then go ahead and let them use it. Lee, I really appreciate you taking the time today.
Thank you. Thanks for all you do.
All right. Take care. Well, you know, that is a horrific story, and I'm not going to let it go, because I think that it will be the blight, that will be the witch trials of our time, the fact that countless, hundreds of thousands, perhaps in America, millions around the world will have died because there was an agenda to stop something that works. What a thought, right? That we actually can cure viruses using products like that, antimicrobials, antivirals, the things that are, you know, being tested and tried and are working around the world. Meanwhile, while we make it virtually illegal to use a product that people have been getting at a pharmacy every day of their lives for 70 years because it was safe, we have a trial that ended after several weeks, essentially, and now the world is being vaccinated with a product that has never been deemed to be safe. We're seeing all the headlines of death and destruction.